Welcome to the Vocal Dental Nurses with your hosts, Kate and Shelly.
Hello, hello, hello. Hey, Shelly, how you doing?
I'm very well, thank you, lovely. How are you?
I'm very well, thank you, Mrs. Good. Well, everybody, hello, welcome back. Shelly and I have had some cheeky annual leave, been a bit busy, but we're back just for a brief hello today, just so that we can big up those wonderful dental nurses, the unsung heroes, aren't we, Shelly?
We are indeed, yes.
How's your week been?
Not too bad, not too bad. It's gone quick again. As you know, at the minute, I'm not really in surgery much. I won't bore everybody to tears with it, but
drinking coffee,
sat at a desk. Our practice manager left in July, and so between me and two other girls, we're trying to do the management side of things. So I'm not in surgery much at the moment, which, to be honest, I can't say I'm enjoying. I much rather, I think, you know where you are in surgery. Yeah. You know what to do. Whereas, sat at a desk with the paperwork, it feels like it's never ending. There's people on the phone all the time. And I think I just want to sit in surgery with my heart 90s on, ticking patients off the list as we go so I can see the day. I do. I miss it. So, yeah, I'm going to, once things settle down a bit more, that is, that's my aim, to get back into surgery on the days that I am there. So, yeah.
Yeah, I don't blame you. I mean, we know, I think we're going to touch upon some of the additional qualifications for nurses as it happens. And obviously, a lot of nurses do go on to move into practice management. But it's fantastic to have that dental knowledge. And for those practice managers out there that don't have the clinical knowledge, that's fine too. And it obviously works. But being a dental nurse, I think, can be an advantage when you're doing that role. Personally, anyway.
Yeah, definitely. It's definitely got its advantages for sure. Yeah,
absolutely. I mean, with the within your team, are there many that have gone on to do additional qualifications?
Well, yeah, Jag he likes everybody that comes to the practice, whether they're trainee or qualified. Once they are qualified, he likes everybody to have their radiography. And actually, we had the results yesterday and two of our girls have passed. So they've got they did the NEBDN one, which I think I've heard on the grapevine is quite tricky. I mean, I did that one going back over 10 years. And it was difficult then because it was all negatively marked. So there was no just have a go, no, because if you got something wrong, you get points deducted. So over the recent years, we've used BDA for their radiography, which seems to be a lot more user-friendly, should we say.
Okay.
But they had quite a big waiting list when we signed our girls up. So, yeah, they've done the NEBDM one and two of them passed. So we're really pleased for them.
Oh, that's great. I mean, it's a massive help for the clinicians to have nurses that are qualified like that. Not only, for the nurses with it being job satisfaction. I mean, I'm going on experience of, I was always happy to have the additional skills because I loved it, much like yourself. But it helps the team out, helps your clinicians, doesn't it? If they can.
Not all of the dentists use the girls to take their x-rays, and that's, it's personal choice, but the boss and then some of the others, they do, they quite enjoy. Yeah. And it's some of the younger dentists we've got in as well. I think they really promote it. They like the girls to get involved. Yeah. So it's nice. So so he always pushes people forward for the radiography. And the other one he likes everybody to have is the impression taking.
I knew you were going to say that one.
So that's we've just had, I think all our girls are done in that one. There's just 3 that signed up. They went on a day course a couple of weeks ago. I can't remember the name of the provider now, but they just went on a day course. And then they've got to do their portfolios and that. So, that's another one he likes them all to have, because then that means he can go and have a sneaky cup of tea.
Absolutely. But do you know what? And that is good, though. Exactly what you've just said. I mean, Jag, who is Jag and Ben, they obviously actively encourage that within your team, which is fantastic. But not just that, they actually use it as well. So, you know, it isn't, you know, the girls just go off, or boys, to get that additional qualification. They are actually using, you know, utilising their skills.
Which is really important, because as we all know, if you don't do something often, you sort of forget how to do it. I mean, I came back after, I can't remember which maternity break it was. And one thing he's never pushed me to do is PAs. He'll always do the PAs himself for the x-rays. I'll do all the bite wings. He does the PAs. And I came back after having one of the children, and he said to me, "Oh, can you take a PA of the upper right 6?" And I looked at him and went, "No, no, I can't. No." He was like, "Oh, right, okay." I was like, and I said to him after, "I haven't taken a PA in years. Don't just spring that on me." So it does. I mean, they do, you know, they don't just sort of walk out and be like, "Right, get this done, do this." It's, you know, if you're feeling uncomfortable, he will, you know, help you out, as it were.
Yeah, of course. I mean, I also know, only because obviously we work with a lovely Bewdley lot, is that we know that one of your nurses is also gaining another qualification as we speak in the TCO, treatment coordinator.
Yes, Deb's, yeah, she signed up for her TCO. I think she started that at the beginning of this year.
Yeah.
That's something that she's really become interested in, really, over the last couple of years. We're both, since you and Carl joined the practice, Debbie pushed for us both to go on and do the national exam in the implant nursing, which we've both done and both really, really enjoyed. And then, yeah, I think she's enjoyed working alongside the implant patients so much that she sort of went to Jag and said, you know, perhaps this is a road I'd like to go down. What do you think? And yeah, he was more than happy, really pleased with the work she's done so far, the treatment planning she does. So yeah, that's all in hand at the moment.
It's a massive, I mean, as they all are for practices, you know, I mean, you've just said, you know, even joking aside, you know, if one of the girls taking the impression, it gives Jag an extra minute to have a cup of tea, or perhaps do his notes, or something else.
Yeah, something related to dentistry.
But it gives them that time. And obviously, as you know, I'm a massive advocate of TCOs anyway.
Yeah.
But for the team, the practice, the team, the owners of the practice, the TCO, you know, is worth their weight in gold for so many reasons, and for the team, you know, because they've got that massive support within the role. So for that being an additional qualification, there's quite a few nurses that take that up, which is great to see.
Yeah, I think
sedation.
As well, sedation, yes. None of us are qualified in sedation, but then we don't use sedation at Bewdley, so that's not something that we're doing at the moment. But yeah, especially alongside things like your implants and all the surgery and stuff like that, sedation would be a really good one, to have.
Oh yeah, massively. And I mean, again, I know nurses, you know, are often hungry to do things like that. But again, if you're not going to use it in practice, it's not a reason not to go ahead and do it. With the qualifications, and I'm certainly not asking you, Shelley, this is just really putting it out there. I mean, I've come from practices previously where we've just named some. What have we said for the extra qualifications? TCO, implant,
X-rays, impressions, sedation.
So let's say those 5. For nurses to go on and do them, they're rewarded in their hourly rate normally within a practice. But there have been some corporates, I shan't name them, but they'll only allow a reward of 2 qualifications. And one corporate actually included the dental nurse qualification in that. So it meant if a nurse went on and did another, they'd only get
yeah, that's a bit stingy, isn't it?
For one, it is, yeah, because as you know, you've got to be a dental nurse to be able to get the other qualifications.
Yeah.
So it is a shame, and you know, a vast majority of the nurses that I actually work with then did it off their own back, and they didn't get rewarded for it, but they wanted that qualification, you know, which says a lot about dental nurses.
Absolutely.
You know, as a whole.
Yeah. Absolutely. I think they can, from working in surgery, you see how much more you could be involved with. Like you said earlier, job satisfaction, that's it's a huge part of it. And that's, the pay might not always be reflected as it should. You'd like to think there would certainly be some incentive to go on these courses. But I think it does add that variety and that responsibility to your day and to the job that you do, and you can take pride
100%.
that you've gone out and you've done that. But because some of them, especially the national exam ones, they could be really expensive. So if you haven't got the backing of the practice, that's, it's a huge chunk of money to come out of what's not always a fantastic wage.
I was going to say, not a well-paid job, and that's I bring it back to that's why a lot of nurses do it for the love of the job, because you certainly wouldn't be doing it for the money. But that said, I think it's fantastic that it says a lot about them, and that's pretty much what I'd say, because they still go on, they still take these qualifications, don't they? So with the qualifications, I mean, I know, Shelly, but I'm just saying to anybody that may be out there listening, once you've got that qualification, that's your qualification. It isn't something that you've got to renew. I mean, obviously you've still got to do GDC, CPD and stuff like that, but it's not a renewal thing, is it?
No, the radiography you have to then do inside your 5-year CPD cycle. You have to make sure that it's IRMA regulated. But I think that's sort of the only extra thing that you have to be mindful that's like being covered. Yeah. But the rest is, once you've done it, you've passed, you've got your certificate, you're away. You're away. You're flying.
Radiograph.
You're gagging the patients.
It won't be long before Jag can have, his feet up and having more cups of tea while you girls take over his palace.
Yes, he'd like that. He'd love that. I mean, we've had a couple in the past ask if they can do another big one, although I don't know if it's sort of dying out slightly. One of the other big ones was the oral health education. We've had a couple of girls in the past say, come to him and say, oh, I'd really like to do this. And he sort of turned around and said, well, no, that's not going to benefit me. That's not going to benefit our practice. We've got 4 hygienists. We don't sort of need. So, in that sense, it's got to, from a business point of view, it's got to work, and it's without sounding, it's got to benefit Jag and the dentists within the practice. And it's
100%, especially if they're funding it. Yes,
exactly.
I can understand that. If you put your business hat on, then yes, of course, you're not going to pay for a course for a member of your team if it's not going to be utilised within the practice. Same with fluoride application,
and that's another one. That's come up again. One of the girls, and he was like, "Well, no, it's just simple for me to just." Get some Durafat and put it on there, and then I'm not going to, get up and leave the room, because by the time I've stepped out of the surgery, it's on. It's so it's got to work 100%. Both ways.
Oh, absolutely. No, I totally agree.
But there's lots of sort of smaller courses out there that aren't as. I mean, the ones we've mentioned are huge, and they can take up to 12 months to do. But there's quite a few. There's some really good ones that I've done on the Dental Nurse Network. Like your infection control, so you infection prevention control lead. They're really good, really insightful. There's lead dental nursing courses on there. That that they only take sort of 3 to 6 months, and they're half the price of the bigger ones. So maybe if people did want to move forward and haven't got the backing of their practice, there's there's other things out there that aren't going to cost the earth, should we say? Yes,
100%. 100%. I think that's a good call, because, as you say, it's a hefty amount to be taken out of a smaller wage packet, let's say.
Absolutely.
Bless you. Well, Shelley, I think we'll keep it short and sweet.
Yes, that suits me. I shall go to fetch the children now.
They always say just another roll. That you do.
Just never stops, does it? From one cap to another, it's just.
Oh, please! You're so smooth. Everybody out there, as always, thank you very much for tuning in. The score. We'd love it if you wanted to share your advice, your opinions, or your experience. Please just contact us, Kate@HortonImplants.com. We would love it if you would join us. Take care, everybody. Shelley, thank you very much. Have a good weekend.
And to you, dear, and you. Bye, everybody. Bye-bye.
Bye.